Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 43 of the Ask Dr. Angela podcast. It has been a simply beautiful fall here in New Jersey. And I know you guys are probably thinking, oh my gosh, she talks so much about fall. Well, fall happens to be my favorite season. And I really have been missing the fall. I'm a Midwesterner, and I'm going to go out on a limb and say that this is actually the first fall that I feel like we've experienced since being in New Jersey. And we've been in Jersey for about 4.5 years now. But typically, I found that the falls in Jersey have been kind of drab. No significant change in the color of the leaves. It goes straight from hot and humid summers to cold winters. I have, however, been pleasantly surprised by this year's fall. I mean, the weather has been spectacular, specifically the change in the color of the leaves. I mean, they've been just brilliant. I mean, the oranges, the reds, the yellows, really, really beautiful. Sort of puts me in the mindset of what I'm accustomed to experiencing in the Midwest. However, I am going to say that I don't really miss the winters in the Midwest. I don't think that we in Jersey really get winters, comparatively speaking. I actually think that it snowed in the Midwest this past weekend. I'm going to have to check that out and see. Anyway, let's delve right into today's question, which has to do with the difference between Novasure and Myosure. As you can probably imagine, once people find out what I do for a living, I get curbside consulted a lot. As soon as I tell people that I'm an OBGYN and that I do a weekly blog post and that I have this podcast on iTunes, they're like, oh my gosh, let us ask you a question. We hope you don't mind. And of course, most of the time I never do. So I had the pleasure of speaking with a young lady not so long ago, and she was having some issues with her periods, i.e. heavy periods. Who isn't affected by that, right? So anyway, she says to me, my OBGYN was talking to me about some Sure procedures, Novasure, Myosure, whatever. Aren't they the same things? And so I simply looked at her and I said, well, actually, no, they're not the same thing. So here's the difference. Novasure is a type of ablative system. And notice I said a type because there are numerous types of ablative systems that we use to treat heavy periods. Novasure actually is my favorite. Novasure is my favorite because it's easy, it's quick, it's minimally invasive, and of all the ablative techniques, I have personally found that my patient population has done the best with Novasure, the Novasure technique. Novasure works by radio frequency, and it basically burns the lining of the uterus. The lining of the uterus is what you shed every month as your period. I typically counsel any of my patients that are undergoing any sort of ablative technique that the goal is not to no longer have any periods, but to obtain what we call eumenorrhea. And that just means having periods that are not interfering with your quality of life, i.e. periods that are normal and that allow you to function in the way that you normally would be functioning, not like these monstrous periods where you can't leave the house, you can't go to work, etc. So I like Novasures. Again, Novasures are quick. And when I say quick, less than 5 minutes. They're easy. They're minimally invasive. They don't involve hormonal manipulation or invasive surgery such as, say, for instance, a hysterectomy. Now, Myosure is an entirely different procedure. It's done hysteroscopically, and it involves removing potential causes of heavy bleeding. So the thing that Novasure and Myosure do both have in common is that they are both utilized to treat heavy periods. However, Myosure is used to treat those structural causes that are associated with heavy bleeding. They're going to include things like polyps, submucosal fibroids, etc. These are things that the Myosure is utilized to remove hysteroscopically. I've actually become a huge fan of the Myosure technique because prior to its inception, we were doing hysteroscopies and sometimes blindly removing polyps with polyp forceps, but the Myosure allows actual visualization. And even with some of the other hysteroscopes, i.e. the Princess scope or whatever you may have, the Myosure is more sleekly designed. I think it's less bulky, it's more streamlined, and it gives excellent visualization. I use the Myosure quite a bit, and it gives me confidence, if I'm treating someone with one of these structural abnormalities, i.e. polyps or fibroids, that I have completely removed the tissue in question. So in summary, both Myosure and Novasure, although they do sound like twins, they are quite different, and they basically treat the same issue, which is heavy bleeding, but the issue becomes what's causing the heavy bleeding. If it's something structural like a polyp or a fibroid, the Myosure is going to be more what you would want to use for a treatment option. Novasure, however, even though it does treat heavy periods, the major difference in how it works is that it uses radio frequency to, again, burn the lining of the uterus. So you're not actually removing tissue with the Novasure, but you're ablating or burning it. Both options I think are fantastic with regards to treating heavy periods. And the thing that you need to know is that you have many, 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 many different options, and all of them are not surgical, but that's another podcast altogether. So hopefully that has helped to explain some of the differences between Myosure and Novasure technologies. Okay, in wrapping up episode 43, I'd like to thank you guys and gals for listening to the Ask Dr. Angela podcast. It certainly is always a really good time, and I enjoy being able to provide you with this information that I'm hoping is adding some sort of value. If you have a question or a concern or a topic that you would like reviewed or addressed on the Ask Dr. Angela podcast, please go to www.askdrangela.com. Click on the microphone on the right-hand side of the page and do what you do. In closing, I'd like to leave you with this thought. Just as much as we see in others, we have in ourselves. Remember, people, don't sell yourself short. Until next time, look better, feel better, be better. I'm looking forward to reconnecting on episode 44. Thank you.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.